Noah and I will be discussing reflex arcs. So a reflex is a rapid involuntary response to a stimulus, and these reflexes can be both inborn or acquired. So when a reflex is inborn, that means it's intrinsic and it's unlearned. So it's something that's built into our neuronal anatomy. So an example of this would be touching something hot. When you touch something hot, you don't need to be taught to pull your hand away, you just automatically do it. And then with acquired or learned reflexes, as Dr. Bill mentioned earlier, that's something that's going to result from practice or repetition. So an example of that is learning how to drive or driving in general. So a reflex arc is a nerve pathway that's going to be involved in a reflex action. It can involve one or more different synapses, and reflexes as a whole will play an important role in the survival and well-being of different organisms. Okay, so now let's talk about the components of a reflex arc. So a reflex arc is going to have five main components. It's going to have a receptor, which is going to serve as the site for a stimulus action. It's also going to have a sensory neuron, which is going to transmit afferent impulses to the central nervous system. Then you also have the interneuron, which is going to be in the middle. It's also called a relay neuron, and it's part of the integration center. So it's going to receive information from the sensory neuron and process it within seconds. You also have the motor neuron, which is going to conduct the efferent impulses from the integration center and send those impulses to the effector organ, which is going to be a muscle fiber or gland cell that's going to respond to these different efferent impulses. And for reflex arc specifically, the effector organ is going to be a muscle fiber or a group of muscle fibers. So now let's talk about the different reflex types. So reflexes can be categorized into three main groups. They can be functional, simple, or complex. In the functional group, you have autonomic and somatic reflexes. And then you also have monosynaptic and polysynaptic for simple and complex. So an autonomic reflex arc is also going to be known as a visceral reflex, and it's going to affect your inner organs. So it's going to have smooth or cardiac muscle contractions or even gland secretions. An example of this could be a change in blood pressure, heart rate, pupillary response, or even digestion. And in this image on the right, you can see an example of a visceral reflex response to high blood pressure in the body. So when high blood pressure is detected by the baroreceptors, there's going to be impulses sent throughout the body with afferent neurons and efferent signals. And the efferent signals are going to be sent to the effector organ, which in this case is going to be the heart. And an inhibitory signal is going to be sent to the heart's pacemaker, which is the AV node, and it's going to lead to a decrease in heart rate and an overall decrease in blood pressure.
So here we have somatic reflex arc. So the somatic reflex arc allows for rapid autonomic response. So you don't have to be conscious of it, and it's for potential harmful or threatening stimuli without need for conscious processing. So it consists of five basic components: the receptor, afferent sensory neurons, integration center, efferent motor neurons, and effectors. So then an example here includes the knee-jerk reflex, so the patellar reflex, the withdrawal reflex, so pulling your hand away from something that's hot, and then the gag reflex, so it protects from choking. And then next we have monosynaptic. So in a monosynaptic connection, an action potential travels down the axon to a presynaptic neuron and arrives at the axon terminal. So these neurotransmitters bind to the receptor on the postsynaptic neuron, causing ion channels to open and close. An example here would be the knee-jerk reflex. So when a doctor taps the patient's knee with the hammer, you send sensory neurons in the muscle and it detects the stretch and transmits an electrical signal to the motor neurons in the spinal cord. And then these motor neurons then send an immediate signal back to the muscle, causing it to contract. And then it causes the knee-jerk movement. For polysynaptic neurons, so a polysynaptic is the communication between two neurons where information is transmitted from one neuron to another. Would be the withdrawal reflex pathway. So when you touch something hot, your sensory neurons in your skin detect the temperature And it transmits the signal to the spinal cord, then the spinal cord senses the neuron synapses, and then it turns it into a motor neuron, so you move your hand away, calling the withdraw reflex. And then here I've shown a picture depicting the hot object, and then when you place your hand there, and then the withdrawal reflex. And then lastly, we have clinical significance. So the clinical significance of the Reflex Arc lies in its use for neurological assessment, diagnosis of neurological disorder, evaluations of spinal cord injury, monitoring autonomic functions, and ensuring patient safety during surgical procedures. By understanding and interpreting reflex response, healthcare professionals can gather valuable information about the function of the nervous system and provide appropriate care to treat the patient. And then we have our references here.
Okay, very good. So, it's open to discussion.
Yes.
There's some questions. Hello.
No questions.
No questions. Okay, I have questions. Yeah, few questions. Can you tell us what is the importance of the study of this arc reflex in our patient? Erysa, Noah? Importance of the study of the arc reflex in our patient.
Well, if a patient has slow reflexes or any kind of delay reflex or dysfunction, it can mean that there's a problem with their central nervous system or even the peripheral nervous system. Maybe there's um, a problem with the nerve, there's a pinched nerve, there's a missing nerve connection.
Okay. So we must, when we do a general physical exam, we must do, since the first day that we see the patient, we must study our reflex of our patient. It's not only when they tell you that they have this or this related with the locomotion or whatever, other activity, motor activity. It's something that we must explore since the first moment. Okay? And report in the medical record if everything is okay, or if you observe something that is telling you that the nervous system and the motor activity of the body of that patient have some disorders. Okay, so it's important you to remember to during the physical exam, general physical exam, to always try to detect the R reflex. Okay. And I remember that you mentioned during the presentation that the arc reflex could be monosynaptic, polysynaptic, and somatic. And I want you to, with short work, what means somatic reflex, for example. Yeah, I know that you have the slides, but I want like a summary. If you had to summarize what is a somatic reflex in one word, or essentially in few words, what will be this to give the idea of how we can remind this term and the association with the content.
It's going to be involuntary, so you don't really have to think about this reflex at all or your reaction.
That's the somatic?
Yeah.
Mm-hmm.
And why soma? Why we call soma?
Oh, body.
It's body, exactly. A reflex that we're going to observe in the body. Soma means body. Okay? Okay. And when we talk about monosynaptic and polysynaptic,
It has to do with the number of synapses or the number of connections between
exactly. Monosynaptic will be only one synapse.
one.
It's mono, it's one. There are not several. And polysynaptic will be
More than one.
more than one. Exactly. Okay? That is going to be involved in that reflex arc. Okay, very good. Thank you. And this one that we observe here in this moment is the one that characterizes the knee jerk. Okay, very good. Next one.
Next presentation.
Next presentation.
Or...
Yeah,
okay.
next presentation. And congratulations.
We're actually going to skip ahead.
Let me before let me congratulate because the slide this time excellent with good sites, the letters, the font, everything. It's very clear. We can follow everything in the PowerPoint. Congratulations.